The other thing I was gonna say that I really like about this conference is they're kind of talking a lot about how the whole family is serving,
Mm.
and, like, they really get the whole family into it, and so my kids, they're 12, 10, and 5,
Mhm.
and they're so excited for this to happen because they're like, "Mommy, can we come? Can we help? Can we wear the T-shirt? Can we?" And I was like, "What T-shirt?" They're like, "Let's just make a
We
T-shirt."
gotta have a
Yeah,
T-shirt.
because I guess all the small businesses, they have, like, the coffee mug or,
Yeah, all
like, the
merch stuff.
whatever, the merch. Yeah, the swag.
Yeah,
And so my daughter was like, "We need swag for the new patients." It's like,
but that's fun though.
it's so fun, and they're really excited, and it's so different from, "Mommy, do you have work tomorrow?" Like, that's how they ask me when I go to the hospital, and I thought I was doing such a good job, like, being, like, happy
Yeah,
or, satisfied or, "I'm fine, I'm good."
yeah,
But your kids can tell,
yeah,
and it's, like, very subtle, and then they'd be like, "Was someone mean to you today?" And I'm like, "Oh my gosh,
yeah,
I don't want you to ask me that, like, that's terrible."
yeah,
And I don't
yeah.
want them to grow up and be like, "That's what it is to be a doctor." For, like,
Right.
it's like going to battle, and then you're in the
Mhm.
trenches, and you come back finished, and then you go and do it again, and, like
And even if it isn't that field, just having your kids engaged in what you do
Yeah,
is
exactly.
cool.
It's so cool. I mean, I've asked them, "Do you wanna do medicine?" My daughter wants to do veterinary medicine, my son's obsessed with birds, and then the younger baby is kinda the 5-year-old is just
We don't
happy.
know yet.
Yeah. He's just completely feral, like, he'll do his own thing. I don't
Yeah,
know.
I know that,
I'm
yeah.
not sure.
The 3rd one, I have 3, and the 3rd one, I'm
Yeah.
like, I don't know what.
I don't know what's gonna happen. They
Yeah,
might be the most successful.
I know. Most independent,
Right, super independent, super clever.
because we doted on our first one.
Same.
There wasn't a moment where we weren't face to face.
Right.
And now, we have a 2-year-old, and we're like, "Where's Simone?
Yeah,
Where is
totally.
she? She's
Yeah, no,
around here
they just
somewhere."
do their own thing.
Yeah.
It's amazing. I know. I don't do peds, but I do adult medicine, and it's one of the things I'm looking forward to is having a different age groups to take care of because they're in different stages of life, and, like, this is my season, but I've lived through different seasons, and it's nice to see kinda how you can help, you know?
Yeah.
I mean, I think I identify the most with, mid-40s, professional women,
Mhm.
and my hope is that I can serve them, learning HRT and how to take care of perimenopause and menopause,
Mhm.
and it's very different from what I've done, but I am loving learning about it because it's, like, gonna help me too.
Mhm.
But I also wanna just help people feel better,
Yeah.
and, like, a lot of these moms are so, so busy, and they're like, "Oh, I'm just busy and overwhelmed, and that's why I feel poorly." I
Yeah.
said, "No, don't worry about it, it'll get better," but it's not getting better,
Yeah.
and then they go to the doctor will gaslight them and be like, "It's just part of life," and you're like, "Why? Why does that have to be part of life? That's
Yeah.
not nice."
Yeah. It's nice.